Nipah virus. Sign and symptoms. The symptom starts to appear within 3 to 14 days after exposure. Initial symptoms are fever, headache, drowsiness, followed by disorientation and mental confusion. These symptoms can progress into coma as fast as in 24 to 48 hours. Encephalitis, inflammation of the brain, is the dreaded complication of Nipah virus infection. Respiratory illness can also be present during the early part of the illness. Nipah case patients who had breathing difficulty are more likely than those without respiratory illness to transmit the virus. Transmission diagrammatic illustration. Transmission. Initial outbreak was reported in Malaysia and Singapore. Incidental human infections resulted after exposure or close contact to infected pigs, transmitted initially from bats to pigs. No occurrence of person-to-person transmission was reported in this outbreak. In India, person-to-person transmission of Nipah virus is presently reported. This is most commonly seen in the family and caregivers of Nipah virus infected patients. Transmission also occurs from direct exposure to infected bats. A common example is consumption of raw date palm sap contaminated with the infectious bat excretions. Mortality. Very high mortality. Out of an estimated 582 human cases of Nipah virus, 54% were fatal. Prevention. The infection can be prevented by avoiding exposure to bats in endemic areas and the sick pigs. Drinking of raw palm sap, palm toddy, contaminated by bat excrete, eating of fruits partially consumed by bats, and using water from wells infested by bats should be avoided. Bats are known to drink toddy that is collected in open containers and occasionally urinate in it, which makes it contaminated with the virus. Standard infection control practices should be enforced to prevent nosocomial infections. Treatment. Currently, there is no effective treatment for Nipah virus infection. The treatment is limited to supportive care. All suspected cases of Nipah virus infection should be isolated and given intensive supportive care. Ribavirin has been shown effective in vitro tests but has not yet been proven effective in humans. The anti-malarial drug chloroquine was shown to block the critical functions needed for maturation of Nipah virus, although no clinical benefit has yet been observed. Diagnosis. Laboratory diagnosis of Nipah virus infection is made using real-time polymerase chain reaction from throat swabs, cerebrospinal fluid, urine and blood analysis during acute and convalescent stage of the disease. IgG and IgM antibody detection can be done after recovery to confirm Nipah virus infection. Immunohistochemistry on tissues collected during autopsy also confirms the disease. Viral RNA can be isolated from the saliva of infected persons.